Good morning, and today we'll discuss vitamins and nutritional assessment. So, this is part one of our discussion regarding vitamins. So, let's start with our discussion. Okay, so regarding vitamins, nutrition can affect both healing and health. Okay, so if you have better nutrition, you'll have better health, and it's easy for your body to recover from stress or diseases. Okay, so that's why we need to feed our body with food rich in nutrients. Okay, next, regarding nutritional components of our food, we have the macronutrients and micronutrients. So what's the difference regarding macro and micro? Okay, so for macronutrients, it's macro because it's usually needed for energy production or use as source of energy. Okay, so regarding macronutrients, first you have carbohydrates. Okay, then second you have lipids. Okay, primarily you have your triglyceride. Okay, and next you have proteins. Okay, so those are the three macronutrients. So the first macronutrient that is used by our body as source of energy, it's carbohydrates. Then if there's depletion in carbohydrates, then the next source of energy is lipids. And after that, if there's depletion in lipids, your body will try to use proteins as source of energy. Okay. Next, regarding micronutrients, it's required by the body in only minute concentrations of milligrams or less. So these are the vitamins, minerals, and trace elements. Okay. So for micronutrients, you only need small amount or small concentration, but for macronutrients, your body needs higher or bigger concentrations of macronutrients because you're using them as source of energy. Okay. So, regarding vitamins, vitamins are low molecular weight compounds with a wide range of functions in biological tissues. Okay, and regarding vitamins, it serves as a cofactor in many enzymatic reactions. Okay, so meaning of cofactor, it should be present in order to activate the enzyme for enzyme to have its function. Okay, kaya diba? When we talk about enzyme converts a substrate to product. Okay, and our body is heavily dependent on enzymes in terms of biochemical reaction. So without vitamins, there are enzymes that are not active. Okay, without vitamins, there are enzymes that are not active. So remember, vitamins serve as cofactors for some enzymatic reactions. Okay. Now, regarding the types of vitamins, you have fat-soluble vitamins, okay, and water-soluble vitamins. So for fat-soluble vitamins, you have vitamin A, D, E, and K. Okay. For water-soluble, um, you have thiamine, riboflavin, niacin, vitamin B6, vitamin B12, biotin, folate, and vitamin C. Okay, so regarding water-soluble vitamins, these vitamins are readily excreted in the urine and are less likely to accumulate to toxic levels in the body. So usually, for water-soluble vitamins, these vitamins are not associated with hypervitaminosis. Okay, meaning excessive amount of a certain vitamin, hypervitaminosis. So the thing that is associated or the condition that is associated with water-soluble vitamins, it's hypovitaminosis. Okay. The reason why it's difficult for our body to have an accumulation of water-soluble vitamins is because it's readily excreted, okay, in the urine, and because of that, it's like less likely to accumulate, okay, in our body. Okay, but for vitamin A, D, E, and K, which are fat-soluble vitamins, there's a tendency for our body to have hypervitaminosis of these fat-soluble vitamins. Okay, so when talk about hypovitaminosis, this term hypovitaminosis, the usual cause of this one is inadequate intake of a particular micronutrient or vitamin, or there is problem with absorption. Okay, so there is malabsorption syndrome, or there's a problem with your gastrointestinal tract. Okay, so for this one, for our body to maximize the nutrients from our food, we need to have a healthy gastrointestinal tract. Okay, so that we can harness the nutrients, all the nutrients from our food. Okay, so remember, hypovitaminosis, there is a cause, you have inadequate intake, or there is problem with the absorption. And when we say hypovitaminosis, you have decreased concentration of a particular vitamin. For hypervitaminosis, there is increase, or there's accumulation, okay, of that particular vitamin in your body, and it's already toxic, okay, and usually it's associated with fat-soluble vitamins, okay. Okay, so let's start with vitamin A. So vitamin A, uh, first, retinol and retinoic acid, these are retinoids, are derived directly from dietary sources, primarily from retinyl esters. So these are the vitamin A present in your liver, okay, or from metabolism of dietary carotenoids, or provitamin A, primarily beta carotene. So beta carotene is a provitamin, so meaning you need to convert this one to vitamin A. Okay, so regarding vitamin A, it's also known as retinoids. Okay, so for retinoids, you have three types. You have your retinol, retinal, and retinoic acid. So in terms of conversion, first you have your retinol, then it will be converted to retinal, and last one you have the conversion of retinal to retinoic acid. So these are um, what do you call this? Retinoids or vitamin A. Okay. Now, regarding vitamin A, it's an essential micronutrient. Okay. Meaning of essential. What's the difference between essential and non-essential? Meaning, if it is non-essential, you don't need to eat it or get it from your diet because your body is capable of producing it. That's the meaning of non-essential. Okay, but if it is essential, meaning your body cannot produce its own vitamin A or produce its own set of, for example, amino acids. So there are essential and non-essential amino acids. Okay, for vitamin A, it's essential, meaning you need to get it from your diet. Okay, it's essential. Okay, your body cannot form vitamin A. So you need to derive it or get it from your food. Okay, so regarding vitamin A is important for the health of your rods, okay? The rods in your eyes. Rods are responsible for night vision, okay? So that's why people with vitamin A deficiency will experience night blindness, okay? It's because ang rods, it's dependent on vitamin A. The health of your rods is dependent on the presence of or levels of vitamin A, okay? Now, what are the sources of uh, vitamin A? So, for the artificial one, you have supplementation. So, there are a lot of supplements, okay? Vitamin A supplements that are available in drugstores or pharmacy, okay? Another, you have natural sources. You have fish liver oil, liver, butter, whole milk, egg yolk, pigmented fruits, and vegetables. Okay, so liver is a good source of vitamin A. Okay, so that's why those people with those people who are following carnivore diet or if they follow keto diet, if they're heavily dependent on meat and animal products, usually they'll not suffer from vitamin A deficiency because liver is rich in vitamin A. Okay. And another thing regarding vitamin A is a fat soluble vitamin. Okay. So you need lipase and bile salts for the absorption of vitamin A. Okay. So you need to have a healthy pancreas and a healthy gallbladder for you to absorb vitamin A from your food. Okay, so that's for vitamin A. Okay, so regarding functions of vitamin A, first is vision. So vitamin A is important for the health of your rods, and rods are responsible for night vision. Next, you have cell division and growth, then bone and teeth formation, epithelialization, metabolism, reproduction, and uh, regarding reproduction, if you're vitamin A deficient, you'll have problems with your fertility. Okay, so vitamin A deficiency can cause infertility. Okay, now regarding vitamin A and retinoids, the active form of vitamin A is retinoic acid. Okay, so retinoic acid is the active form. So you need to convert retinol to retinal and retinal to retinoic acid. So to convert that one, so you have retinol dehydrogenase plus zinc to form retinal dehydrogenase. Uh, no, no, no. So for the conversion of retinol to retinal, you need the enzyme retinol dehydrogenase and zinc. So this one activates retinol dehydrogenase. Okay, zinc. So without zinc, there's no conversion of retinol to retinal. And next is the conversion of retinal to retinoic acid using retinal dehydrogenase and zinc. So zinc activates retinal dehydrogenase. Okay, so zinc is a cofactor. Okay, so it activates the enzyme needed in the conversion of the inactive form of vitamin A to active form. Meaning, if the patient or a person is zinc deficient, then that person will also exhibit symptoms regarding or symptoms about vitamin A or pertaining to vitamin A deficiency. Okay, so if there's zinc deficiency, it will also lead to vitamin A deficiency because there's deficiency in the active form of vitamin A. Okay, so it's a type of mineral, or zinc is a mineral that is needed in the activation of a vitamin. Okay, so zinc deficiency is a type of mineral deficiency that can cause vitamin D and vitamin A deficiency. Okay. Now, regarding vitamin A, it's teratogenic, meaning it can cause disturbance in the development of fetus. Okay. And it's abortifacient, meaning it can cause abortion. So it's not advisable to give vitamin A supplementation or to give high levels of vitamin A to pregnant women. Okay. So that's the caveat. Okay. Now, regarding the types of or forms of deficiency for vitamin A, you have primary deficiency and secondary deficiency. So for primary deficiency, there's low intake of food rich in vitamin A. That's for primary deficiency. And for secondary, the problem is in the absorption, meaning there's a problem with your gastrointestinal tract in terms of absorption. Okay. So, for example, if there's pancreatitis, so there's a problem with the production or um, production sa mga enzymes, or if there's gallstone, okay, it can also cause problem with the absorption of vitamin A. Okay, so those are the functions of vitamin A and types of vitamin A deficiency. Now, regarding functions and the effect of vitamin A deficiency. So first effect is, let's start with the function of vitamin A. So first is retinal rods. So it's important in the maintenance of the health of your retinal rods. So if you're deficient of vitamin A, you'll experience nyctalopia, or meaning night blindness. Okay. Another, vitamin A is important for normal cell differentiation. It prevents squamous cell metaplasia. So if you have deficiency of vitamin A, you'll have metaplasia. And it's important for normal epithelium and prevent keratinization. So there will be keratinization if you have deficiency of vitamin A. And next is normal bone and teeth, or healthy bone and teeth. So if you have deficiency of vitamin A, you have bone and teeth problems. And another function of vitamin A, it's the maintenance of mucus secreting epithelium, and it stimulates the immune system. So it's responsible for the secretion of lubricant. Okay. So for cirrhosis cutis, meaning there is dry skin, abnormal dry skin. Okay. It's due to the deficiency in vitamin A. Another is xerophthalmia, so dry conjunctiva. It's because of vitamin A deficiency, because vitamin A is needed in the production of lubricant, the mucus. Okay, and vitamin A is important in the stimulation of immune system. So if you have vitamin A deficiency, you'll, you're prone to infection. Okay. Next, when ingested in high doses, either chronically or acutely, vitamin A causes many toxic manifestations, and it may ultimately lead to liver damage due to hypervitaminosis D, hypervitaminosis A. So usually, if there's hypervitaminosis A, it can cause liver problems because it will deposit in the liver. Okay, so that's the problem with vitamin A. There's a possibility of accumulation of vitamin A if there's excess intake, okay, of vitamin A. Okay, because it's not easily excreted. Okay, next, fat-soluble vitamin. You have vitamin E, and it's an essential type of vitamins, meaning you need to get it from your diet. It's fat-soluble. Then you have four types of vitamin E. You have alpha, beta, gamma, and delta. Okay, so the most potent is alpha, and gamma is the most abundant. So regarding sources, you have artificial sources like supplements. An example of this one, you have Myra E. Okay, so Myra E. For natural, you have corn oil, soy oil, sunflower oil, fruits, grains, and vegetables. So those are the natural sources of vitamin E. So regarding functions of vitamin E, uh, uh, it's important, okay, to it's important, antioxidant in our body. Okay, that's the function of vitamin E. And regarding antioxidant, okay, so uh, all of us are exposed to different free radicals every single day. So the job of vitamin E is to convert free radicals to detoxified radicals. Okay, so this is harmful and this is harmless. Okay, so free radical is harmful. So the job or function of vitamin E is to convert the free radical. Okay, so you have your reduced form of vitamin E. So the reduced form of vitamin E will convert free radicals to detoxified radical, which is harmless. Okay, so after that, after the conversion, the reduced vitamin E will now become oxidized vitamin E. Okay. Now, for it to convert, for this oxidized vitamin E to be converted to uh, reduced form, you need vitamin C. Okay, so vitamin C is also important in fighting free radicals because it converts oxidized form of vitamin E back to its reduced form. And remember, reduced form of vitamin E is the one responsible for the conversion of free radicals to detoxified radicals. Okay, so that's the function of vitamin E and association of or relationship of vitamin E to vitamin C. Okay, so it protects against membrane peroxidation or damage of the membrane, and it's also important for the synthesis of coenzyme Q or ubiquinone. Okay, and it's also needed in the synthesis of DNA and RNA. So if there's a deficiency, there are two types, primary and secondary. Same for vitamin A. Primary, it's decreased intake, and for secondary, there's decreased absorption. Okay, so that's for vitamin E deficiency. Next, functions of vitamin E and its deficiency. So function of vitamin E is to protect against membrane peroxidation or damage to the cell membrane. Okay, so for RBC, if there is a deficiency in vitamin E, um, RBCs will have shorter lifespan because they're prone to hemolysis. Okay, there's hemolysis because there is damage to the cell membrane of red blood cell. And there's a possibility or there's a presence of acanthocytosis. So for acanthocytosis, these are red cells with uh, thorn-like projections. Okay, the reason why there's thorn-like projections is because of damage in the cell membrane. And the cause of that is the deficiency in vitamin E, because vitamin E is important to maintain the health of the cell membrane. So it prevents early oxidation of the cell membrane. Okay. So if it is for muscles, the effect of vitamin E deficiency will have muscular dystrophy, and for nerves, you'll have neuropathy. Okay, and for retina, you'll have retinopathy. So these are the effects of vitamin E deficiency, and the cause of that, it's because of early oxidation of cells. Okay, so there is early injury to the cells. That's why there's muscular dystrophy, neuropathy, and retinopathy. Okay, so that's for vitamin E deficiency. Okay, so let's talk about the effect of vitamin E and warfarin to coagulation. Uh, because vitamin E plus warfarin, vitamin E supplementation plus medication of warfarin can cause internal bleeding. Okay, so let's start with the function of vitamin K. Okay, so the vitamin K, the active form of vitamin K, converts or activates inactive clotting factor. Okay, so there are vitamin K dependent clotting factors. Okay, so meaning these are the clotting factors that need the presence of vitamin K for its activation. So example, you have 2, 7, 9, and 10. So these are vitamin K dependent clotting factors. So vitamin K, the active form of vitamin K, is important in the activation of clotting factors. So for this one, after that, they have activated clotting factor. Okay, and if you combine it with calcium, then it will form or it will proceed with coagulation. Okay, now this one, after activating 2, 7, 9, and 10, this vitamin K will now become inactive. So inactive vitamin K. So to convert this one back to active form, back to its active form, you need the enzyme epoxide, okay, epoxide reductase. Okay, so epoxide reductase is needed to convert vitamin K, the inactive form of vitamin K, back to its active form. Okay, now regarding warfarin, this drug, okay, inhibits epoxide reductase. Meaning, if you're taking warfarin, you're prone to bleeding. Why? Because it will not convert the inactive form of vitamin K to active form, which is very essential in the activation of your vitamin K dependent factors, clotting factors. So there will be a depletion in the concentration of active form of vitamin K when you take warfarin. Okay? Now, if you add vitamin A supplementation, okay, if you're doing warfarin medication and vitamin A supplementation, that's very bad. Why? Because vitamin A has the same effect with warfarin. It inhibits epoxide reductase. So you have two factors na instead of one. So, it can cause internal bleeding because ang warfarin palang daan, it's a potent drug in inhibiting epoxide reductase. And you add vitamin A supplementation, na grabe ang effect. It can cause internal bleeding. Okay? So, you need to avoid using warfarin and vitamin E supplementation at the same time. Okay? Okay, so next fat-soluble vitamin. You have vitamin D or your cholecalciferol. And primary function of this one is for mineralization. And you have the active form, which is vitamin D3. And sources, you have supplementation and natural source. You have oil, yolk, margarine, butter, lard, sunlight. For sunlight, it converts 7-dehydrocholesterol to vitamin D3. Okay, that's the function of sunlight. Okay, it's not the source, but it's needed in the conversion of 7-dehydrocholesterol to vitamin D3. And you have green leafy vegetables. So those are the sources, natural sources of vitamin D. Okay, so next, regarding functions. First, you have intestinal absorption of calcium and phosphate. So let's talk about PTH for this one. PTH, then calcitonin. Okay. Okay. So for uh, PTH increases calcium concentration, diba? Okay. But the effect of PTH to phosphate is decrease in phosphate. Okay. For calcitonin, you have decrease in calcium and decrease in phosphate. So there's no Uh, the problem with this one, the effect of PTH have decreased phosphate and calcitonin have decreased in phosphate. So we need a counter hormone. Okay. So the counter to that is you'll have your vitamin D because vitamin D increases calcium concentration and it also increases phosphate concentration. Okay. So one of the functions of vitamin D is to promote intestinal absorption of calcium and phosphate. Okay. So vitamin D is also important in the mineralization of bones, and it's also an immune system modulator, and it's also needed in insulin secretion and blood pressure regulation. So those are the functions of vitamin D. So what are the causes of vitamin D deficiency? So first is decreased sunlight exposure. So for example, in cold countries like Scandinavia, there is less sunlight. Okay. So less sunlight, less conversion of the 7-dehydrocholesterol to active vitamin D. Another, if you have dark skin or black. Okay. So if we are going to compare black and fair skin, okay. So if you have a fair skin, okay, so you have less melanin, okay, and for black skin, you have I don't know. For black skin, you have high levels of melanin or more melanocytes producing melanin. Okay, so the purpose of that melanin is to block the sunlight. Okay, or to have less sunlight nga maka-enter sa imong nga skin. Okay, so reason to that is to or rationale to that or rationale is to decrease the uh, risk of skin cancer. That's why black na mga people, they are not that prone to skin cancer, but they're prone to vitamin D deficiency. It's because of the melanin, okay, present sa ilang skin. Okay? So it will result to less exposure to sunlight. Okay? So less activation of vitamin D. For fair skin, they have less melanin, so they will be exposed more to sunlight. So advantage, they're not prone to vitamin D deficiency, but they're prone to skin cancer. Okay? So both ang black o ang fair, nasa like it's they have their own advantages and disadvantages. Okay? So for black, less light exposure because of the melanin. So meaning less chance or not prone to skin cancer, but they're prone to iron deficiency, vitamin D deficiency. For fair skin, more light exposure or sunlight exposure. So more light nga maka-enter sa skin. But the problem with that, okay, they're prone to skin cancer. They're not prone to vitamin D deficiency, okay, but they're prone to skin cancer. Okay, so in life, uh, there are no solutions mandagay. There are only incremental trade-offs. Okay, so meaning if there's a problem, uh, no, ano na lang. Every person kaya siya advantage and disadvantage. Okay, so inana. So we have trade-offs na lang. Okay, so if fair akong skin, so I'm not prone to vitamin D deficiency, but I'm prone to skin cancer. So I'm not fair ha, ako sa middle dagay. So less exposure sa sunlight or entrance or entry sa sunlight, but less pod og ambot na lang basta na to. If black, more melanin, less sunlight nga entry. Okay? So less activation of vitamin D. So you're prone to vitamin D deficiency, but you're not prone to skin cancer because of that melanin also. For fair skin, balikon, so more sunlight nga entry to your skin. So more activation of vitamin D. So not prone to vitamin D deficiency, but prone to skin cancer. Okay. Next, hypomagnesemia. Okay, so remember, magnesium is an important cofactor. So it activates a lot of enzymes, including the enzyme needed in the conversion of inactive form of vitamin D to active form. Okay. Next, old age and uh, kidney disease. Because if you're old, you're prone to kidney disease, and if you have kidney disease, there's less formation of active form of vitamin D because kidney is important in the formation of active form of vitamin D. Another, if there's malabsorption and decreased PTH, this is decreased PTH. Okay, so for vitamin D deficiency, it's associated with bone problems like rickets and osteomalacia. So rickets during childhood and osteomalacia during adulthood. Okay, so same lang na silang dua. The difference lang is the onset of the disease. So rickets during childhood, osteomalacia, adulthood. Okay, so if there's vitamin D excess or hypervitaminosis D, that patient is prone to kidney stones. Okay, it's because of increase in calcium. Next, fat-soluble vitamin, you have vitamin K. Okay, so it's an essential vitamin, so you need to get it from your diet. So it's fat soluble, so you need a healthy gut to uh, absorb vitamin K. So you need to have healthy pancreas, healthy gallbladder, healthy gastrointestinal tract. Okay, so vitamin K1, vitamin K2, and vitamin K3. K1 and K2 are natural. So source of K1, you have green leafy vegetables. Vitamin K2, you have liver and bacteria or the normal flora in your intestine. So it produces vitamin K2. Okay. Vitamin K3, it's synthetic and it's water soluble and it's usually administered in neonates. So the purpose of this one, since newborn or they have for newborns have sterile gastrointestinal tract. So there's no bacteria in their gastrointestinal tract that is capable of producing vitamin K2. So to supplement that one, or to solve that problem, you need to administer vitamin K3. Okay. So vitamin K3 is synthetic and it's usually administered in neonates to provide the neonate or the newborn with vitamin K, which is essential for clotting or coagulation. Okay. So sources, you have artificial, so you have supplementation, and natural, you have food like spinach, lettuce, and broccoli, and the gut bacteria. So gut bacteria is a major source, it's a good source of vitamin K, so it produces vitamin K. Okay. Next, so functions. So first is coagulation. It's so if there's vitamin K deficiency, usually there will be bleeding, and it's important for bone mineralization. So expected nga there will be bone problems. And third function, you have decreased calcification of soft tissue. So if you have vitamin K deficiency, you'll have calcification of soft tissue. So these are the problems in patients with vitamin K deficiency. Okay. So causes of vitamin K deficiency, you have use of broad spectrum antibiotics. So it will also kill your normal flora. So if there's no normal flora in your gut, there will be less production in or less source of, or there will be a decrease in vitamin K in your body. Then high dose of vitamin E, because vitamin E inhibits um, epoxide reductase, and epoxide reductase is the enzyme that is important in the conversion of inactive form of vitamin E to its active form. Another, warfarin, same with vitamin E, it inhibits epoxide reductase. And sterility, or during kanang sa mga newborn, okay? They have sterile gastrointestinal tract, okay? Another is malabsorption syndrome, okay? This sterility does not pertain to infertility, ha? It pertains to the neonates or the newborns. They have sterile gastrointestinal tract, okay? So if there's vitamin K deficiency, it's associated with deep tissue bleeding. But for vitamin K deficiency, it is expected that there's normal platelet count. And regarding bleeding time, it's also normal. But there's a problem with your APTT and PT. So you have prolonged prothrombin time and prolonged APTT. Okay, but the bleeding time is not affected. Okay, so because for platelet, it's responsible for kanang bleeding, or ang affected if there's a problem with platelet, it's bleeding time. And if the affected is the clotting factor, then it will also affect your prothrombin time, activated partial thromboplastin time. So for vitamin K deficiency, normally there's normal platelet count and normal bleeding time. Okay, but there's a problem with your APTT and PT. Okay. So I think that's all for the first part of our discussion regarding vitamins. So next meeting, we'll proceed to part 2 and part 3, and also parts of our short discussion regarding trace elements. Okay, so thank you.